I'm Dr. Barb DePree. I've been a gynecologist and women's healthcare provider for 30 years and a menopause care specialist for the past 13. In my practice, I see women of our generation who are independent, well-informed, and assertive in every area of their lives, except when it comes to vaginal changes due to menopause. Although most of us are perfectly at ease talking about menopause symptoms like hot flashes and night sweats, many women still seem uncomfortable talking about symptoms like vaginal dryness. And if women are not talking about vaginal dryness, they're not getting the treatment they deserve. I want you to know that even if you find it embarrassing to discuss your vagina, for your doctor, it's like talking about your knee or your ear. As healthcare professionals, it's our job to know about your symptoms so that together we can find a treatment that works. That's why I'm here today. If exercising or walking or just going about your daily activities causes uncomfortable rubbing or friction, and even if your silkiest lingerie makes you feel like you're wearing sandpaper underwear, you could have vaginal dryness due to menopause. Vaginal dryness can also cause other symptoms like itching, burning, irritation, painful sexual intercourse, a condition called dyspareunia. If you have any of these symptoms, you're not alone. In fact, vaginal dryness is the most common bothersome symptom of menopause. Like hot flashes and night sweats, vaginal dryness is caused by falling hormone levels during menopause. But unlike those symptoms, vaginal dryness due to menopause is a chronic medical condition that won't go away without treatment. Actually, it could even get worse. The good news is that safe and effective treatment options are available. One of these options is called Osphena. Osphena is a non-hormonal tablet that you take once daily by mouth with food. No vaginal application is required. Taking Osphena may increase your risk for cancer of the lining of the uterus, a stroke, or blood clots. You and your healthcare provider should talk regularly about whether you still need treatment with Osphena. If you are experiencing moderate to severe vaginal dryness due to menopause, ask your healthcare provider about Osphena today. You can also find more information at osphena.com.
Important safety information, including boxed warning and indication. Indication. What is Osphena? Osphena is a prescription oral pill that treats moderate to severe painful intercourse, moderate to severe vaginal dryness, symptoms of changes in and around your vagina due to menopause. Most important information you should know about Osphena. Warning: endometrial cancer and cardiovascular disorders. Osphena works like estrogen in the lining of the uterus, endometrium, but can work differently in other parts of the body. Taking estrogen alone, or Osphena, may increase your chance for getting cancer of the lining of the uterus. Vaginal bleeding after menopause may be a warning sign of cancer of the lining of the uterus. Your healthcare provider should check any unusual vaginal bleeding to find out the cause, so tell him or her right away if this happens while you are using Osphena. Osphena may increase your chances of having a stroke or blood clots. You and your healthcare provider should talk regularly about whether you still need treatment with Osphena. Call your healthcare provider right away if you have unusual vaginal bleeding, changes in vision or speech, sudden new severe headaches, and pains in your chest or legs, with or without shortness of breath, weakness, and fatigue. Who should not take Osphena? Osphena should not be used if you have unusual vaginal bleeding, have or have had certain types of cancers, including cancer of the breast or uterus, have or have had blood clots, had a stroke or heart attack, have severe liver problems, are allergic to Osphena or any of its ingredients, or think you may be pregnant. Tell your healthcare provider if you are going to have surgery or will be on bed rest. Possible side effects. Serious but less common side effects can include stroke, blood clots, cancer of the lining of the uterus. Less serious but common side effects include hot flushes or flashes, vaginal discharge, muscle spasms, headache, excessive sweating, hyperhidrosis, heavy vaginal bleeding, vaginal hemorrhage, night sweats. Tell your healthcare provider about all of the medicines and supplements you take, as some medicines may affect how Osphena works. Osphena may also affect how other medicines work. Duchenet USA encourages you to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For full important safety information, please see prescribing information, including boxed warning and patient information, at osphena.com.